We now have the ability to truly tap into all of that data and really to be able to deliver it to the physician at the point of care. So it's probably everything that I've worked on, from an EHR perspective to a patient portal perspective. All of that data still come together to just drive better, more informed decisions.
For decades, the healthcare industry has built systems to document and store data. But too often, the data remains locked away in portals, PDFs, or siloed platforms. What if the right data could reach the right hands at the right moment, empowering clinicians, supporting patients, and transforming the entire care experience? That's the challenge and opportunity facing oncology today. And it's the focus of our conversation in this episode of the Innovate Oncology Podcast. In this episode, we're joined by Andy Corts, Chief Technology Officer at OneOncology. With more than 2 decades of experience driving digital transformation in healthcare, including leadership roles at Ernst & Young, HCA, and Sarah Cannon, Andy has been at the center of every major paradigm shift in clinical technology, from patient portals to EHRs, mobile solutions, cloud platforms, and now the transformative potential of AI. Andy shares how his journey has been defined by one guiding question: how can we better capture, connect, and use data to improve patient care? He reflects on the persistent challenges of EHRs, the importance of elevating the patient experience beyond portals and PDFs, and the opportunity AI presents to transform cancer care, from clinical documentation to triage to decision-making at the point of care. Now, let's dive into our conversation with Andy Corts.
Thank you so much, Andy, for joining us today on our podcast. I know that you have really been at the forefront of digital transformation as a whole in a ton of different roles. So as we get started, if you don't mind, maybe just diving into what does that journey look like for you across your career?
Yeah, I'd be happy to chat through that career journey. I was lucky really to start in 1999. So if you think of every paradigm shift for computing, I got to experience it in healthcare. And the first role after school was actually with a concept. It was a patient portal company. And the idea is we would go build websites for physician practices with the idea to facilitate and streamline patient communication, which to this day we're still working on 25 years later. Really, that paradigm was all about on-premise computing. I took that experience. I went to work for Ernst & Young. And at the time, what was going on there was really the EHR transformation. So again, all on-premise. And so I spent a lot of time implementing EHRs, learning all about EHRs, understanding the impact of EHRs. And then I left Ernst & Young in 2004, joined HCA, and spent 15 years at HCA. The first 4 really were all around HCA's EHR strategy and how we could leverage EHRs to really take a more comprehensive approach to patients' care. And in 2009, I left and joined a startup at the time called the Sarah Cannon, but it was a joint venture between Tennessee Oncology and HCA. And the real goal there was to develop out research infrastructure, not just for the joint venture, but for all of HCA. So spent 10 years as CIO at Sarah Cannon Cancer Institute, doing a host of things, namely, the next kind of paradigm shift in computing came, which was mobile computing. And so worked a lot at how can we get more and more information at the fingertips of physicians. And then, the latest kind of area that we're in it was what I would call cloud computing. And I think the thing that we worked on at least the most, whether you say, hey, patient portal, or whether you say EHRs, or whether you say cloud computing, all of it was how can we enable better documentation? And I think, when you think about the forefront of digital transformation, all those touches piece of it, but where it all kind of came to rest was the data warehouse. And, particularly today, you see the value of a data warehouse every day. When we start talking about AI, we're on the Databricks platform and all the things that Databricks does to enable AI. I think the whole journey really has been around how can we grab more and more different types of data. So, the early days, how can we grab patient data, EHRs, how can we make sure that every department in the hospital has a comprehensive health record, mobile data, how can we get data, at the point of care, and then eventually, how do we get it all in the cloud so that it's comprehensive enough? and that we can access it. And then now the transformation of AI and all of the different things that AI can do. To me, the journey really has always been about collecting data and centrally housing it and then getting it back into the hands of the clinicians. But now empowered with AI, it's certainly changing the game dramatically.
Yeah, and building off of what you just said, when you worked with the EHRs and you've seen this trajectory of how data and just EHRs have grown, and now this new concept of AI coming out, what do you think the gaps are between the EHRs today and like the actual care coordination that's going on around it from an AI perspective?
Yeah,
Do you see gaps in that piece?
I think today, there's so many things that happen today in healthcare that probably still happened 25 years ago. And a lot of it is because the EHRs are still were designed in the 1990s. And that 1990 design is so entrenched in our billing system and the way that we treat for patients and the way that the payers expect the care to be delivered, that there are, a host of gaps in terms of what the experience should be like. My father was recently hospitalized, and it was kind of a troubling experience to get to a diagnosis. We didn't know if it was sepsis. He had a whole host of issues, and we were in the ICU. And so every day we would meet with a different specialist that kind of had a different view of the record, and then a different specialist. And then in terms of us getting access to all that data, none of it would flow to the patient portal because they hadn't been discharged yet. So we were still struggling with access to information. In my head, it was almost like, man, what should be going on in this ICU experience is every specialist that comes in, all of that exchange between the patient and the physician, which we get a little glimmer of today in kind of the physician specialty office, but all of that dialogue between us and the specialist should be captured by AI and recorded. And then as the next specialist comes in, they should be building upon that. It should be building upon that. And then all of a sudden, this comprehensive summary of all the conversations that we had that day with different care specialists coming into the room should be available to the patient, and the patient should be able to pound it however they see fit to say, like, well, what does this mean? And what does this mean? And what does this mean? And we do it today. I mean, the funny thing is today, I still go to the Frisk Clinic, and I'll go to my annual physical here in a few weeks. And what I'll do is I'll pull up eClinicalWorks to the patient portal there, and I'll literally go to my lab results, and I'll take a screenshot, and I'll upload it to ChatGPT, and I'll have a 30 to 45-minute discussion about all of my lab results.
Yeah. Yep.
That, I should be having that discussion with the doctor, but for the most part, the doctor's so busy that they're in and out.
That's
and I can spend time with the AI and actually have a deeper, more meaningful conversation. We know what the experience should be, but getting there and getting the transformation is just incredibly difficult. And look, I've been at it for 25 years, and, I'm still frustrated with patient portals in a lot of ways of like, oh my God, this is incredibly frustrating in terms of what we can do, but there are certainly glimmers of hope.
Yeah, and some of the feedback that we've gotten, which I'm sure you've seen happen as well throughout your career, for example, is, this patient sees on the portal, because maybe they were discharged, a really alarming diagnosis, such as a cancer diagnosis. And you think about the patient experience of, they found out about that by going to their portal. And that's obviously not what we want to happen, but we do see that in the industry time and time again. And so your view of the EHR is really similar to mine. It is that, it does what it does well, but it doesn't really encompass this full care coordination and patient at the center of like what healthcare should look like. So I agree. We've made strides in the right directions, but there's always room to improve and grow together. So
one thing I was going to say about that at least I'm trying to change on a daily basis here at OneOncology. We acquired a platform that's a patient portal. It's called Navigating Care. First and foremost, it's a patient portal. It does patient education. It's supposed to streamline the discussions and the educations between our cancer providers. They use it at Tennessee Oncology, one of our partners. And the other thing that we've launched there is, they call it care management, but at the end of the day, it's nurse triage. And I deal with this all the time, and it drives me crazy. One, either with the pediatricians where my kids are getting treated, or even for myself when I'm being treated, is you'll inevitably have a question for your doctor. You'll get on the phone and you'll call and they say, hey, let's patch you through to the nurse. The nurse could take your call. Well, the nurse is never there. And so you always end up getting the nurse's voicemail.
Yep.
And then I'm always in a meeting with like the exec team here. And I know that the one thing I want to do is just catch the phone, get the phone call from the nurse at the right moment to where I don't have to send her a voicemail. But it'll always be like I'm with my boss and my boss's boss. And I was like, God dang it, the nurse is calling. And then it'll go to voicemail. And like, so then like, the only data I'll get is these little exchanges and snippets of voicemail when I really want to just spend about 10 minutes on the phone with this nurse asking about this pain or this diagnosis or this drug. And so the Navigating Care platform that we launched creates basically a call center of nurses that could triage. And then as you call in with triage, they can text you back. We can enable this. I'd say one of the biggest revolutions we can have in healthcare is just giving a voicemail phone tag so I can be in a meeting and text so I'm still.
It's funny that you say that. My phone is right here because I need a prescription filled for my kid before the weekend. Yeah. And so I'm just waiting because I'm like, please get this on a Friday afternoon and call this in.
Right. And it could never be texted to you like, hey, we got it. Are you sure this is good? And we're going to put it at this CVS. Why that dynamic cannot happen with our physician practices is beyond me, but that's certainly something we're working on every day here.
Yeah, that sounds great. Kind of on that front, as you put these new technologies in place that empower the efficiency of the team, especially the clinical team, the providers and the nurses, how do you balance keeping that human side of care with these technologies coming out?
Yeah, end user experience, whether it's a digital experience or whether it's face-to-face with a nurse, like that whole experience, I think ultimately can decide whether or not it was a great experience or not. And so it's one thing if we have a nurse and we're face-to-face and the care delivery is amazing, and then all of a sudden you go home and the digital experience totally falls down. Like it's not independent, you may have had this great experience, but now that you have the digital experience, you're left with a bad taste in your mouth. Mm-hmm. And so I often think we as technologists, we have to deliver the same kind of experience as you can get if you're talking to a world-class nurse or world-class physician. Yep. And it's telling you everything you know. We need to deliver the same experience digitally. And a lot of that is about how easy it is to log in. Yes. I mean, just how much data is actually available and there, and then what's the actual functionality of the device. For whatever reason, patient portals, we now have meaningful use, we have MIPS, and basically what was deemed like the low bar from a government regulation is what all patient portals do today. And once an EMR hit that low bar, they stopped developing in the patient portal and all the developers went someplace else. And so from my perspective, we got to continue to push the patient portal, the capabilities of the patient portal to match what, the quality caregivers that we have, the experience that they give our patients, the love and care. It needs to be there with the patient portal in the moment that all it is is an online record or basically a bunch of PDFs. It's a pretty disappointing experience. So the two have to go in tandem.
Yeah. And meeting the patient where they're at, it doesn't have to be the same experience for everyone, but if you can provide that experience that frees up some of the face-to-face time or some of those actual calls, it gives you more time to spend on those maybe elderly patients or patients that need a translator and things like that come into your practices. So that's good insight. And then I have to ask you, sitting in the CIO chair, and working in the industry, how do you look at or want to see things like ROI when net new products or features are coming to you to say, I think we need these in our practices. This is the ROI. Like, what is appealing to you as a CIO?
I think, there's two things there. If they have an actual financial ROI, meaning, hey, we're going to actually generate more revenue from this, then that's certainly something that's a really easy sell. And we have that scenario a lot. I find myself selling right now a lot of AI projects to our exec team, and that is all in the name of clinical efficiency. A lot of the execs, a lot of people think sometimes too, hey, are we going to see a lot of cost labor reduction from this AI app? And I kind of have to explain to them that I went out to San Francisco a couple of weeks ago, visited Databricks headquarters. It was a really amazing visit. 6 or 7 different AI companies that were all in the startup space, all doing amazing things clinically. So it's a super exciting place to be. And I was leaving Databricks headquarters. I was heading back to my hotel, and I got in a Waymo, the autonomous vehicle. So there's no taxi driver. It was totally empty, and I enjoyed a nice little ride, albeit it was a little slow. But, there was no taxis, no cab smell. It was a nice Jaguar, and I could pick my own music in the back seat. And I kind of have to remind our exec team that wants to see more autonomy in our business process. So I would love RCM robot that comes in and works the prior authorization and goes to the payer portal and submits that payer portal and does that all autonomously. And I say, look, Google's there today with Waymo because they spent billions upon billions of dollars. And for 2 years, there was a taxi driver watching that Waymo drive itself. I said, so we're still very much in the era of co-pilot mode, where we can't just build autonomous robots and they go off and submit prior authorizations or they go run a call center. Like, there always has to be a human in the loop. There always has to be a human supervision. There always needs to be checkbacks with the human to say, yes, you may proceed to the next street. Yes, you may take a left here. Yes, you may take a right. So we should see a human that could do 20 prior authorizations in a day at OneOncology expand to 100, but certainly autonomous business and labor reductions, we're not really ready for that yet. But we are on our way to autonomy, but for now, it's a co-pilot game for sure.
Yeah, absolutely. And with these growing volumes and lesser people to do the work, I mean, it's a need that exists today. So that really resonates with us as well. Well, I would say maybe just in closing, what is the next innovative roadmap item that you have that is most exciting?
I mean, I think obviously AI is a game changer for us. Taking the patient record, the ability to take all of the unstructured data that forever has sat in our data warehouse, kind of stored away. And while we played around with certain kind of concepts of abstraction, we now have the ability to truly tap into all of that data and really to be able to deliver it to the physician at the point of care. So it's probably everything that I've worked on, from an EHR perspective to a patient portal perspective. All of that data still come together to just drive better, more informed decisions. And AI will certainly be in the epicenter of that. So super excited about where we're going here with that. And I do think cancer care in general will be transformed. There's probably not a better industry that is more ripe for innovation when it comes to large language models. Whether it's an administrative function in RCM, we should be able to greatly streamline that, but also, healthcare at the point of care, having the physician be able to kind of educate the patient and let them know all the things that they're doing, but also having the latest and greatest evidence at hand. And then from a digital experience, having that patient be at home and, rest assured that the right care is happening because they have access to these large language models and the ability to really navigate their own care.
Love it. Couldn't agree more. And I think the healthcare world and AI in general is just developing so quickly. It's exciting to be a part of it. So thank you, Andy, so much for your time and your expertise and all your commitments. And congratulations on all your achievements as well in this space. We're grateful for your time today.
Great to spend some time with you. I greatly appreciate it and humbled by the opportunity.
As Andy reminded us, innovation in oncology isn't just about technology. It's about ensuring that every digital advancement, from patient portals to large language models, ultimately supports the human side of medicine, delivering timely, compassionate, and informed care to those who need it most. Thanks so much for joining us on this episode of the Innovate Oncology Podcast presented by Azra AI. Be sure to subscribe wherever you listen and catch up on the past episodes on YouTube or wherever you get your favorite podcasts. Until next time, stay curious, stay compassionate, and keep innovating.